Now, in HD, this is Fox Toledo Daybreak.
Well, the month of April is drawing to a close, but there's still time to tell you about Minority Health Month.
Yeah, and Dr. Ronald Charles is with us this morning, and I want to start by saying good morning to you and thanks so much for being here, and also ask, why is there such a high number of people that, maybe are not taking care of themselves better?
Well, a lot of it has to do with the fact that if people have no symptoms, if they don't feel bad, they feel that everything is fine, when in actuality there's several things several diseases that can be present without showing itself and cause damage in the long run. And 3 of those diseases are hypertension, high blood pressure, diabetes, and kidney disease.
And taking a look at the statistics, I mean, they are kind of staggering when looking at the minorities and how much higher theirs are.
Yes, and part of that is because, from a historical point of view, a number of minorities did not have health insurance to be able to access the doctors. A lot of it has to do with genetics and some cultural factors.
Well, I think that is something you hear often probably, is that maybe they don't have the health insurance or the money to pay for this help they need. So what are some options for people? Well,
thanks to the Affordable Care Act, a number of people who worked in jobs, so let's say, that historically did not have health insurance, now a number of those people are able to get health insurance through the health exchange. A number of people are able to get health insurance through the expansion of Medicaid here in Ohio. Due to the Affordable Care Act. So that has allowed a lot more people to be able to access the healthcare system.
And talking about things like high blood pressure, a lot of times people say, yeah, I have high blood pressure. It's really a bigger deal than that. Sometimes something like that people maybe discount, but there are things that they could probably do in their everyday lives to help out with that.
Oh, absolutely. First of all, please go to your find a doctor and go to a doctor. There's a number of ways to access the healthcare system and get access to a physician. There's private physicians, there's hospital-based clinics that they can go to, there's community health centers that are federally funded health centers that where people can access care. But definitely go get a physical, because the result of that physical may allow you to be able to get to find out whether or not you have high blood pressure or diabetes or kidney disease.
And I think there is also this misconception that if you have something like this, it's really hard to beat it or get better, but there are steps you can take at home to keep a healthy lifestyle. Oh,
absolutely. First of all, eating right, eating properly, making sure that you're eating well-balanced meals, making sure that you watch your salt. Something very easy to do. A number of foods that you find in the supermarket have a lot of salt, a lot of sodium. Label read. Make sure that you're reading your labels so that you're getting things with a low sodium content, because salt is associated with high blood pressure.
And really, in talking about this in the long run, even though maybe there may be some sort of money you have to pay up for those, in the long run, preventing those diseases really is going to cost you less, right?
As the saying goes, an ounce of prevention is worth a pound of cure.
Right. All right. Well, thank you so much for joining us this morning.
Yeah, thank you so much.
Thank you,
All right,
ladies.
coming up.